can be sorted out after seeing the embryo in the lab. At times, this can also happen that in a couple who has got repeated IVF failures and we receive embryos and all the embryos are having some kind of genetic abnormalities. In that case, the couple is suggested to go for a donor embryo. Whatever genetic abnormality has come, and if we have to change any gamete, whether a donor sperm or a donor egg, we try to do that to give the couple its ultimate chance of attaining parenthood. Okay, so now I would talk about what are the investigations which we do in couples who come to us with repeated IVF failures. So, as I spoke in my earlier discussion, the first and foremost, if any couple comes to us with IVF failure, we take the couple for an endoscopic procedure. What we call as the evaluation of the uterine cavity from the top, what we call as the laparoscopy, and evaluation of the uterine cavity from inside, what we call as the hysteroscopy. So that is the most important diagnostic tool for us, for as IVF specialists, to understand as to what went wrong, why the embryo did not implant. Again, as I also mentioned earlier, also assess the ovarian function of the woman to find out if egg is not the issue for not having an IVF pregnancy. So there are certain basic blood tests which are again repeated and analyzed, which tell us about the biological clock of the woman or the ovarian function of the woman. And this is knowing the AMH, the baseline FSH, and what we call as the antral follicle count. Now, what are these antral follicles? These antral follicles are the precursors of the oocytes, which is present in every woman and are assessed by the IVF specialists to find out as to what is the reserve of the woman. How many eggs should we get? What would be the quality of those eggs? So this is the assessment of a woman and her ovarian function. We would assess the antral follicle count, we would assess the AMH, we would assess the ovarian volume, we would assess the baseline FSH. Okay, so I think I have to finish my session here because the time is up and we would have a further discussion later on. Thank you so much for hearing me.